Hello and thank you for joining in on today's training. Heart & Solutions is a proud provider of CE-eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below to find and take your quiz.
So we are spending some time this morning talking about the ethical and practical applications of telehealth for mental health professionals. Somebody reminded me the other day that we are almost 4 years now into really diving into telehealth and when COVID hit the world. So it's been a crazy 4 years for sure. And I know some of us may have had various forms of telehealth training over that time or been using telehealth in different aspects. So this may be a refresher for some of us. Some of it may be new. We try to stay up to date with what is going on and what we know. So the information today will be as accurate as I can get it for what we know today. But a little bit about me. My name is Colleen Grote. I have a PhD in counselor education and supervision, emphasis in trauma. I am trained in EMDR and TFCBT. I am a registered play therapy supervisor, and I've been the vice president at Heart & Solutions since 2015. So I live in Marion, and Heart & Solutions has offices across the state, so I get to supervise providers all over. And I do have a new puppy at home. He's sleeping soundly, but some of you have seen him make appearances before. Hopefully, or hopefully not, he may get involved today, but I'm really glad that you are all here. Just as a reminder, this is not legal advice. I am not I'm not an attorney. This training is for educational purposes only. So if you have legal thoughts, questions, things that come up with your individual clients, please seek out necessary legal counsel for that. Everything we're talking about today is just for education. As we spend some time together today, we are going to learn about the key terminology, some evidence, benefits, and risks associated with telehealth services. My hope is that you'll gain an understanding of the legal and ethical concerns associated with providing services online. We'll explore some policies, procedures, best practices, and various forms of telehealth delivery and how to use them effectively with clients. These objectives are somewhat separated, but also intertwined as we talk. So before we really get into all of the ins and outs of telehealth, right, I want to make sure we just take some time to really recognize the obstacles to mental health care. These include things like a shortage of providers. In the US alone, it's estimated that almost 111 million people live in areas that are considered a mental health provider shortage area. And half of the counties in the United States don't provide any access to even one psychiatrist, right? So we have hundreds of millions of people living in areas that are underserved as far as mental health care goes. While we're not talking about things globally today, just to put that in perspective on that global scale, 40% of countries don't have a mental health policy at all. 30% of them lack a mental health program of any kind, and 25% of countries in the world have no mental health legislation. So when we think about the long-term potential implications of telehealth and things like the counseling compact that we'll talk about later and what that could mean for kind of a wider stretch, thinking about being able to give access to millions of people that don't have that right now. Stigma has been around for as long as ever. And unfortunately, while we're making progress and making strides to challenging the stigma, especially around mental health, it's still there. And so the thought of being able to seek help, we know that 2/3 of individuals with a mental health disorder don't seek professional help. While 80% of those adults that were surveyed believe that mental health can be treated and that treatment is effective, they thought that only about 35 to 67% of them believe that other people in the world are compassionate and caring and understanding of mental illness. So kind of that, we still have that big gap of, yes, like mental health is a thing, it's real, and treatment can be really effective, but society as a whole still isn't understanding of what people are experiencing. Fear, right? Again, kind of going along with that stigma. What are people going to think? How are people going to react to me? What is that going to mean? And access. So we know that in the United States alone, 1 in 5 adults is reported to have unmet needs in regards to mental health care. So if we do the math, that's more than 9 million people that don't have access to or the availability to get to a provider and have those needs met. In part because of that stigma, that fear, the shortage of providers. And so all of that combined, right, lets us know that those 1 in 5 adults is struggling and is impacted by a mental illness, but about half of them are getting treatment. So we've got some obstacles to face, and telehealth is a pivotal point in helping challenge and overcome some of these. So talking about some of the technology, the evidence, benefits, and risks. Just a brief overview of some of the words. We won't get into a lot of these today, right? But telehealth, right? Tele at its core just means from afar, right? So from somewhere else that isn't in the room with that person. Synchronous is real-time interactive client-provider communication. So these are your phone calls, these are your live videos. This is what we're doing in real time with our clients. Asynchronous, on the other hand, is active or passive communication. So we don't often think about text exchanges or email exchanges as telehealth, and most of us are not in a position where we're doing actual like session work in that asynchronous form, but any sort of communication with our clients, right, is considered a form of telehealth. And so being mindful of what that text communication or email communication looks like. Telehealth's been around for over 6 decades, right? We don't often think about that. It feels very new, but if we really want to dive in, especially thinking about that synchronous and asynchronous difference, Sigmund Freud was writing letters to his clients, right? So kind of one of the very first implications or uses of distance counseling and writing those letters to clients that weren't currently in session. So while it's been around for over 6 decades, it's been empirically studied for 20. And then with COVID-19, the federal government significantly expanded its access to telehealth around that time and in response to the need in 2020. So prior to COVID, telehealth represented less than 1% of outpatient care. It was available. There were some people doing it, but it was not something that was well utilized. Telehealth visits for mental health increased by 556% between March 11th and April 22nd of 2022. So if we think back to that time and the inability to get in office and how quickly those of us that were working in the field at that time really had to make adjustments and dive into the world of telehealth. So at the peak of the pandemic, 40% of mental health visits were happening online, and telehealth currently accounts for 36% of mental health visits. So we still see a ton of clients that are opting to utilize telehealth now that it is more widely available. So this is just, I think, kind of a nice graph and some visual representation. What we're looking at here is an analysis of outpatient visits during 5-6 month period. So between March 2019 and August 2021, This is data. They looked at over 126 million patients from 156 different organizations, so hospitals, outpatient clinics, things like that, to really just look at what telehealth delivery is looking like. And what just stands out to me here is the difference between the continued use of telehealth for mental health and substance abuse disorders versus other outpatient visits, right? So as we were able to, people started going back in for other kind of outpatient care at clinics, health clinics and hospitals, but have really elected to continue to receive mental health treatment via telehealth. So some potential benefits, right? And I think these are the things we hear a lot and may have had some shared lived experiences with as well. But thinking about convenience, right? Clients can meet when and where they want to. They don't need to worry about when they're moving in state. We'll talk about clients who may move out of state on some later slides. Safety, both for ourselves and our clients, right? They may feel more comfortable in their home environment. We may work with clients who have some greater needs, right, or some safety concerns. We may be in a position where we may be medically vulnerable or things like that, and able to still continue to see our clients from the safety of our own homes. We'll talk more at length about provider experience and client experiences and what those benefits look like as well. We also know, when we think about convenience and being able to meet where they want to, when they want to, we also can think about their ability to meet in a way that's most convenient or appealing to them. So whether that is a video chat or a telephone session, there's been some research done that says that phone sessions actually have really great retention. So while I think there was initially some hesitation about phone only sessions for insurance companies that still allow them, we know clinically that there's great retention to those. So for clients who don't have internet access or aren't comfortable utilizing video chat, we can still see some really great benefits for them. From a provider experience, right? The benefits when we think about the provider experience can really mean things like timely client care, right? So the increased flexibility of being able to schedule sessions at a time that makes the most sense for the provider. There may be times in office where I would need to end my workday at a certain time to allow for the commute to get home or to daycare or wherever I'm going next, and that may be extended. Same with morning sessions if I'm eliminating the drive to the office. For providers who work in multiple locations, right? Again, being able to then see clients who reside in multiple locations without the drive time in between. So some increased flexibility, effective care coordination, right? So we often think about care coordination from the client's perspective and making sure that they're getting all of their needs met from multiple providers or things like that. But care coordination or coordination of care rather, right, for the provider due to telehealth means that we can not only provide effective client care for the clients that we're seeing via telehealth, but we can receive and seek out effective supervision. So we may be able to meet with a supervisor who's not physically local to us, but that has a specialized knowledge base in a topic that we need for that client, right? Or seek out a training that we would not be able to access geographically, but can attend that training online, so that all of this can happen in that virtual context and enhance our provider experience, which results in better care for our clients through that additional supervision and training access. Another provider experience, right, can be an enhanced workforce. So ideally a reduction in turnover, especially in rural areas, right? So we know that rural areas are often underserved and lack access to mental health care. And so being able to hire and staff providers regardless of where they live within that state, and have them be available to those clients, right, can hopefully mean that reduction in turnover, that reduction in change and shift for those clients. And because of some of the other provider experiences and benefits to being able to have things like schedule autonomy, and some other oversight to their own schedules due to telehealth, hopefully some reduction in just their choice to turnover. And we'll talk about burnout reduction and prevention as well as a provider experience here. We also have access to the client's home environments, right? And we'll talk about ways to see the client's environment without jeopardizing client's sense of safety, or pushing clients to do things that they're not comfortable with. But for clients who feel safe, feel comfortable, oftentimes they may give us a glimpse into their home environments, right? So whether that's panning the camera around the room that they're in, working with young children, right, and doing telehealth. I've seen a lot of family interactions in the background, right? Those after school hours and having kids do telehealth and then move to the kitchen to get a snack while you're on with them, and hearing parents or siblings in the background, seeing who else is spending time in their home, getting glimpses of what the home looks like. Those are all things that are often protected when we do in-person sessions, and the client may tell us about them or may describe things, but that access, again, when clients feel safe enough to show us, can really enhance our provider experience of getting to know more about the clients and enhance rapport and things like that. Psychoeducation, right? So we, through telehealth, have access to anything that we need on the computer. So whether those are certain videos or other visuals or things that we want to share with the client, we don't need to necessarily have a hard copy of those, right? To be able to share those and provide psychoeducation with the client and access to different learning tools as we're working in those sessions with them. And community connections, right? So if we do have a client who needs additional support outside of what we're able to provide them, they need emergency services, things like that, we can stay connected with them online, potentially while the client is contacting a community support or while we're contacting 911. So we are able to still remain engaged and connected with them. And then we talked a little bit about it briefly, right? But burnout reduction and prevention. And we work really hard to do this for in-office providers as well, or those who may have a mixed schedule of telehealth and in-office work, which we're seeing more and more of right now. But again, being able to have that autonomy, being able to be in an environment that feels safe and healthy and effective for the provider, right? The hope is that we can reduce some burnout and some of those additional stressors that can come just naturally from the work that we do. In that same vein, for our clients, right, there's several benefits for our clients, and this can include increased access to care. So clients are now able to access providers that are not geographically close to them. And while there's still several limitations about state lines and things like that, it really does allow clients greater access to providers who may specialize in their particular diagnosis, or providers who have shared experiences with culture, race, gender identity, sexual orientation, lived experiences, right? Things that the clients may go, oh, I really wish I had a provider who understood A, B, and C. Or somebody may say, hey, like this provider would be really great for you. They specialize in this presenting issue. Clients now have the ability to seek out those providers, whereas in-office care might have meant, a several hour drive, which is not sustainable or realistic for many, many people. We talked about that continuity of care piece a little bit, right? So again, those reduced travel costs, the ability to continue work with a provider. If the family relocates, again, right, we'll talk about state lines and all of the ethical and legal implications of that. But so long as the client is still in a state where that provider is licensed, being able to continue that care and not needing to restart those therapeutic relationships because of a family move or a disruption to schedule, right? Or things like that. So in addition to that, just the convenience factor for clients. So again, we talked about those decreased geographic barriers, decreased psychological barriers, right? I remember pre-COVID working with a client with pretty severe agoraphobia, right? And we didn't have the option at that time. And I remember this client asking, can we meet by phone? Can we meet, in another way? And at the time, the answer was no. And I think about that client a lot, because had that been a year later, the answer would have been 100% yes. And we have all of these tools and these things. And they were only able to get into the office a handful, if even, of times. And unfortunately, that situation wasn't able to progress the way that they would have liked, right? Or that I would have liked. And so, decreasing those psychological barriers of anxiety or stress related to coming into the office, telehealth can have a huge impact for clients there. Accessibility, right? Can they get there? Do they have access to a provider? Do they have access to transportation? Do they have, do they have physical limitations that would decrease their accessibility to an office or travel time? Less time off, right, from work or from school. Can they meet over their lunch break, right? I've had clients, take their phone out to their car and meet in their car over break or lunch break, or again, being able to kind of sneak their appointment into their day without having to worry about the additional travel time back and forth to something. A decreased need potentially for childcare, again, whether that's because they're meeting on their break at work, right? Or they have children that are old enough to be self-sufficient while they meet in another room, or they have family at home to help with that, but not having to load everybody up or drop them off to get to their appointment. And then enhanced team-based care, right? We talked about that on the provider end of having access to other supports. Clients get to do the same thing. Maybe I have a provider that I really like that's in one part of the state, but my care coordinator lives in another, or my med manager lives in another, and really being able to create a team that is most beneficial for that client, regardless of where that client's living or that care team is located. Some additional benefits kind of specific to certain situations. Children and adolescents, telehealth may be more beneficial than in-person services. Not in all cases, right? As with anything, there's individual needs to be considered, but kids are so aware of technology and what that means and so comfortable with it, right? And being able to kind of open up and show us a world that's unique to them and that's exciting to them. And so they can oftentimes find that they get more out of telehealth than an in-person session because of their level of comfortability. That service delivery is novel, right? It's fun. Their interactions may be more authentic. If they're screen sharing with us or they're showing us something, it gives them a little bit of barrier and protection there, while simultaneously breaking down some of those awkward walls, and allows them to really give us a true version of themselves. We've seen some reduced hospitalizations in the research, right? Due to greater med compliance. I don't need to travel to go to my med appointment. The weather's bad. It's too far. I don't have gas for my vehicle. I don't have someone to drive me, right? But I can still check in with my med provider and I can still make sure that I'm being compliant because I'm doing those check-ins online. Greater symptom reduction, in part because of that compliance, but also being able to find those specific providers and those providers that are best suited for the client's needs. And access to effective therapy and groups, right? So maybe there's a group that's meeting 3 hours away from me, but they're offering virtual groups, and I can now relate to other people and find support that way that maybe is not available in my geographical area. And then ethical and cultural considerations, right? So again, improved access to specialists, people who understand what that client is needing, wanting, somebody who again shares those liked or similar lived experiences or education. Access to interpreters, right? So clients who need an interpreter, being able to do that online and have access to interpreters for various languages in ways that we don't in office. And then the ability to access services in a client's primary language. Right? So being able to, again, find providers who can provide those services no matter where they're located, so that clients can feel more comfortable in session. As with all good things, right, in addition to the benefits of telehealth, we do need to be mindful of the risks and the potential risks of telehealth. And so things like technology issues, less environmental control, privacy, other limitations, right? So we all need to be mindful of technology is great when it works, and not so great when it doesn't. And so what does that mean if technology fails? What does that mean if the internet's out? I have a provider just this week who their internet's been out all week, right? So what does that mean as far as accessing clients? What's our backup plan? Are we comfortable using other forms, right? Whether that be accessing the web-based browser on our phone or telephone. What does that mean for our clients, right? What's the plan if things buffer, right? How long do we give it before we end the call? Who's calling who back if we get disconnected? Having those plans in place for what to do when, not if, right? When technology fails. And then, less environmental control. And so we talked about the benefit of being able to see in clients' houses, right? And what's going on. But I also have no control over what's happening in that environment and who's there and what's going on. And so just kind of, again, having a game plan I had a client early on in COVID, right? When we were still all scrambling to figure out what to do, who climbed out of, it was safe, right? But climbed out of a basement egress window mid-session to go say hi or something in the neighborhood, right? And I'm sitting here going, okay, right? Like, what do I do? We didn't have a plan at that time. And they came back and it was fine. And we went on. I had another client who we had great rapport and after, several sessions would start to wander the house. And it was like, okay, now we've got people who I don't have ROIs for, who I don't even know, right? These are now friends and neighbors and cousins who are hearing this client session, while they're in the kitchen and things like that. And so as time goes on, getting better about having game plans for that, but knowing we are now a part of their world, right? And they're not in our office. They're not in a space that we have a lot of control over. And so just being mindful of that. Privacy, right? Again, related to technology and that environmental control. So who are they choosing to walk around during their sessions? Who's coming into their space? We have some students who do telehealth from the school, right? And while they're supposed to be given a private room, is who's coming in or walking in on that, and just being aware, and privacy with technology issues as well, right? Making sure that we're really mindful of who we're sending that video conferencing link to, making sure we've got correct email addresses, correct phone numbers if we need to connect with them that way. And then some other limitations, right? So we're not physically present with these clients. We work really hard to get as close to that feel as possible, but we can't feel the environment. We can't see everything that's happening. I'm missing out on some body connections. Yeah, and it's hard, right, to remind clients that nobody should be in the room with them, right? They're going, I'm in my space, right? I can do what I want. I can have here who I want. Yeah, but you can't because I don't have permission, right? And mom didn't sign an ROI for your best friend to come over during your session. And how do we handle then? Okay, I need to end the session because you're not having your friend leave. And now I have to kind of explain that to mom why we didn't have our session today or our full session today. So we'll talk about informed consent, but going over all of these things up front, right? And just acknowledging as well, look, I can't see everything that's happening. If you're in the office with me and your foot is shaking, right? I can pick up on that and potentially, address that behavior. I can't necessarily see that. I can't smell things. Um I can't, it's just a different physical presence. And we also have some limitations about the appropriateness of using telehealth. And so when we think about clients, we always want to be screening for best fit and is this an appropriate service delivery? And even though sometimes it feels like maybe this is the only one, right? Maybe we have clients who are in a geographically limited area, we want to be really mindful of is this service delivery a good fit for them? And some clients who may not be the best fit, or potentially even inappropriate for telehealth services, maybe clients who have a serious mental illness, right? So clients who are currently struggling with reality testing or significant suicidality or impulse control like violence or homicidal ideation, right? And I will say the research on kind of the inappropriateness of telehealth for those clients is dated. The 2001 is what one of those studies came from, and so there may be some adaptations to that or some new technologies in place to help with that. But I think it's still really relevant, right? When we think about especially things like reality testing and violence, whether suicidal ideation or homicidal ideation, if we are significantly geographically distant, where does that put us, right? And assessing things like, do they have other support systems? What's their wraparound care team look like? Do they have local supports? Are we familiar with those local supports? How are we accessing those with them or for them if a serious concern arises? So I don't want to say it's a blanket statement like all or nothing fit, but we do want to be assessing fit for services for all clients. And so we want to do things like screen for their diagnosis and the seriousness of their diagnosis. Are they currently in crisis? What's our level of rapport with that client? What's their current motivation for therapy, right? And then like we talked about, what's their support system and do they have other services available to them? And so taking all of those things into consideration as we're assessing fit for clients via telehealth. So getting into some ethical and legal considerations, right, and best practices, kind of what all of that looks like as we come together with that. We've got some federal laws, right? They're important. They're not the most exciting things in the world, but these are important. So we want to take things like HIPAA into consideration. HIPAA makes it incredibly clear when you can disclose healthcare information, right? So HIPAA is telling us you can disclose if. Under HIPAA, there's 4 main rules. So we tend to think about HIPAA just kind of as like, okay, don't give out protected healthcare information. Yes, that's great. But there's a privacy rule, right? So HIPAA dictates who gets to know healthcare information and who doesn't. There's a security law under HIPAA. So how are you securing electronic information? And you as the provider need to be aware of that and be mindful of that, of what are you doing? There's under that security law, there's pieces that are known as confidentiality, availability, and integrity, right, of all information. So you can't just amend a document, be like, oh, like I fixed the document. They need to be able to access the original document. So sometimes I know like on our EHR, sometimes we do need to make an amendment, and there's a protocol to go through to make an amendment, and that's fine. And we want the amended document, but we can't just pretend the first didn't exist. We need to be able to share, how we're keeping those confidential, and how we can make those available to the people that should have access to them. So, and then that integrity piece, right? Of what are the steps? How did we get there? Where's the original document? Where are the new documents? All of those pieces. There's also a breach notification rule under HIPAA. So what happens if someone does get information, whether that's a really small bit of information, we sent the wrong email to someone, and had an oops in there, or potentially a really big information. And your agency is, or if you're in solo practice, you should have a policy about what to do. And that comes from HIPAA, right? They tell us, no, here's what you have to do. Here's how you have to handle it. And we follow that accordingly. And an enforcement rule, right? So HIPAA has an enforcement rule that talks about what the penalty is to you as the provider for not complying with their rules. So just being mindful of, are we following best practices there with HIPAA, and making sure that we're not disclosing, especially via telehealth, right? We're not necessarily seeing all of the parties involved in our client's care, right? So we may not always see both parents or guardians. We may not necessarily, they're not coming into the office. We're not learning who they are. So we may get an email, right, that says, I want case notes or progress notes. Let's always err on not disclosing information if we aren't 100% sure, until we get that confirmation and we double check those ROIs and get those things. As a supervisor, right, I always tell people I would rather apologize for saying, I'm so sorry that we did not share this information because we weren't quite sure who you were, or we weren't quite sure we had the appropriate documentations to do that. Here you go. Here's all the information you are entitled to. Then be on the flip side of that and having a situation where we've given information to someone we shouldn't have, because we didn't do all of those double checks. From a federal window, we're also looking at things like Code of Federal Regulations, consumer protection laws, rules about electronic signatures, website privacy laws, right? And again, this is not legal advice, so we won't dive into all of them, but being mindful of, look, there's a lot of things we have to make sure are in the right space. Are we using websites that protect our clients? Do we have agreements? Most websites do. Now your agencies should be working with web servers that have privacy agreements in place. Where, how can we accept electronic signatures? All of those things that make sure that our clients' best interests are top of mind. And state laws, right? And we're going to talk more about state laws, right? But can you provide that service in your state? Do you have state qualifications there? And those are different state to state. So even in the field of mental health, those vary widely by not only state, but by licensure. And so paying attention to what your degree is and what's your license and what state are you in, and making sure that you are following all the laws in conjunction with that. So licensure laws, right? So in addition to federal laws and state laws, we have specific licensure laws as well. And so you cannot provide professional service or use a professional title without complying with licensure laws, right? So we want to make sure that we are representing ourselves in the best light possible, but also in accordance with those licensure laws. So I have a PhD, right? I can advertise myself as Dr. Grote. Someone who does not, right? While maybe on Instagram or social media, right, can say they're Dr. whatever, they cannot advertise themselves like as that in a professional service. Same with counselors, right? Or social workers or marriage and family providers. We want to make sure they're in accordance with their licensure laws. Every state has a licensing board, and it's set in place to protect the public. And so the public, right, as far as the licensure board is concerned, those are the human beings within the state boundaries during the event. So if you're providing telehealth, where that client is during the session is the state that they are in. So that is the state that has the power to enforce licensure laws. So it's not Iowa's job to protect people in California, right? And this, their responsibility is not to protect the clinician, it's to protect the customer, the consumer, the client in this case. And so the state that we are most concerned with from the client's rights perspective is where they reside. That's the licensure board that's going to dictate the practices they should be receiving. If we look deeper into that, right, the American Counseling Association, their code of ethics makes it really clear that counselors who engage in the use of distance counseling technology and social media within their counseling practice understand they may be subject to laws and regulations, both of the counselor state and the other state. And so we need to be really mindful, right, of where we're at, where our clients are at, and what state laws we need to be held accountable to. And that has changed regularly during COVID. There are some states that have given, had given some temporary provisions of, sure, that's fine, go ahead and see a client who's here, or go ahead and see clients from your state if you're here. That is updating all of the time now as the public state of emergency is gone, as we move into things like the counseling compact that we'll talk a little bit about today. But we really want to be mindful of our federal, state, and licensure laws. So again, just a graphic here, right, of what you want to be paying attention to. And so it's really essential that as mental health professionals and doing telehealth, that we are familiar with jurisdictions and the laws where the clients reside, right? Again, a fairly dated study at this point. I'd be curious to see if it's been updated at all since COVID, but in 2009, over 76% of clinicians stated that they were misinformed about their own state laws, particularly in regards to a legal duty to warn. And that's pretty concerning, right? To be practicing and seeing clients and be misinformed or not aware of state laws. So where's the client, right? Where is the client when you are providing services? When you are providing services, where you are is sometimes state dependent. So states like North Carolina and New York are a little more nitpicky about where you are than other states. So currently, as of today, January 11th, 2024, I make no promises for tomorrow, but as of today, Iowa tells us if your license is in Iowa and your client is in Iowa and you are on a trip to another state, it's okay for you to provide that service. If your client goes on a trip to another state and you are still in Iowa, you may not. So we're really paying attention to where is that client at the time of service. And then you also want to pay attention to where's your license. So getting licensed to practice mental health is something that we choose to do. We asked to get licensed in a certain state. We are, by asking to get licensed and getting licensed in that state, we are electing to be regulated by that licensing board. Nobody forced us to get our license in a certain state. So we're saying, yes, please give me a license. And as a result, I'm choosing for you to regulate my license. But paying attention to, again, where is that client located first and foremost when I'm providing the service, and then where am I at and what does my state say about that, and what does my licensing board say about that? So the counseling compact is something that has come up that people are becoming aware of. Essentially, it's an interstate compact that allows professional counselors who are licensed and reside in a compact state to practice in other compact member states without needing multiple licenses. So you get your license from your home state. You then apply, it's not automatic, you then apply for compact privileges, and you may then practice in those compact states. Applications are not currently open. So they had told us spring of 2024. This has now been pushed back. Most recently, the website said this summer. So we are paying attention to when those compact applications will be open and really thinking about the implications that that will have both for providers and for clients, and kind of what all of that looks like. So the dark blue states are states where legislation has been enacted. There's a few states with legislation pending, several states yet where it has not been introduced. And this is for LMHCs. So like LMFTs, this is not in the works yet. Maybe someday, maybe hopefully someday. So again, when we talk about all of the pieces we need to know from an ethical and legal standpoint, there's a lot, right? Those federal regulations, those state regulations, those licensing regulations, because they're so different. And so if you're supervising providers that are providing telehealth services as well, right, being mindful of, okay, who has what license and what are they doing with that, because it's going to impact so many pieces of the puzzle. We talked a little bit about these earlier, right? But just to recap, those privacy laws, right? So HIPAA regulations, their regulations are healthcare wide, but they do have specific policies for behavioral health. Federal regulations, state licensure laws, your code of ethics. If you're working in the school or with school age kids, it's not as common for us, but FERPA can come up. And also your employer, right? What are their rules and regulations and standards for protecting privacy? So there's a lot to juggle, a lot to be mindful of, and it's ever changing because we don't want to make things too easy. So staying up to date, making sure that we're checking and double checking on things is all important pieces of the puzzle. So ethical practice, right? Once we sort out all of the legal, can we do this? Are we able to do this? We also want to make sure we're providing those services ethically. So things like, are we adhering to our code of ethics, which again, they're very similar, but there are differences between licensing boards. Are we engaging in best practice? And so, our code of ethics, again, is determined by our licensing board. Best practice, we're talking about what actually works the best. And we're going to talk about this more later. Standard of care, right? That's a legal term. And what it really talks about is like, if you were subpoenaed, if you were in front of a court, they'd be assessing the standard of care, which is looking at what would other providers do in the same situation with that client. Is what you did kind of on target for what other providers with the same information would do. And then ethical practice is also driven by research and professional literature, our licensing boards and clients themselves who are giving feedback of what's happening. And so making sure that we're taking all of these pieces into consideration with our telehealth practice. So as we move to telehealth, right, as we either are moving our own practice there or clients are moving more and more to telehealth, most procedures are going to be the same. There are going to be some adjustments. So when we think about ethical practice, we don't necessarily need an entire new code of ethics for telehealth because a lot of what is already in our code of ethics touches on the implications of telehealth, right? So things like boundaries of competence, we need to be aware of and adapt to technology. And digital marketing, right, is something we really need to be aware of as we move. So if you're listing yourself online, if you are using some of the websites that are out there to get your name out there and market and kind of look for clients, which is fine, we just need to be aware that most online companies are not practicing ethically, right? So they are, things like social media, your online presence, your, even your professional profiles, social media exists for profit, right? So they are not designed, social media in and of itself is not designed for healthcare, right? It is designed for profit. And so it is going to kind of take that information, it's going to put it where it wants to, it's going to send it to the people it wants to, that it thinks are going to create profit. So there's some really great websites, some really great things, but we just want to be mindful that our best interests often do not align with the best interest of social media in general and the powers that be there. We talked about earlier screening for fit, right? So screening for fit with clients before maybe they're an in-person client who is moving, right? And is no longer going to be able to get to the office. We do want to screen them for fit for telehealth, right? Do they have technology available? What is their comfortability with technology? And then making sure that we're going over adequate informed consents, right? So giving them information about how online therapy works. What are the expectations? Where should clients be? We talked about some of those privacy things earlier, right? Setting that standard from the jump of, look, this is still your session, right? And we wouldn't have friends over for lunch in my office. So, we want to make sure that you've got a safe space and a confidential space at home. What kind of device are you using, right? Little kids often, we're handed mom and dad's cell phone, which is great, right? But your view the whole time looks like this. And so even talking about things like, can we get a stand? Can we prop it up? Are we on a laptop, a desktop? Are we on a phone? Are we on the phone? Like, what are we doing? The big one for adults too, that we want to set up as we move to telehealth or start with a new telehealth client as far as expectations go is, hey, I don't want you driving, right? And not only do I not want you driving, I'm not going to have this session if you're driving. If you're in your car and I can clearly see that it's parked, absolutely, right? For some people, especially during the height of the pandemic, that was the only place they had where somebody wasn't in their space or could hear them. And again, people may be meeting on lunch breaks or in between their kids' sports practice or things. The car is fine. Driving the car is not. And while clients may say, oh no, it's fine, I can do this, it puts us at a significantly increased level of liability. I couldn't find the most recent training I took. Thankfully, there haven't been any legal implications of that. There thankfully has not been a case of somebody getting in an accident while on the phone with their, or video chatting their provider. But there could be, and I don't want any of you to be the first. And so making sure that the client is not driving or doing, tasks that could be potentially dangerous and need their full attention. So you can set that boundary with them from the beginning. Hey, just call me back when you're pulled over and parked, right? Or let's reschedule for a time that you don't need to get somewhere. I just like this graphic, right? I think we've probably all seen the one of two people like sitting in the chair and untangling thoughts. This is just kind of a graphic depiction of that move to telehealth and what therapy is starting to look more and more like. So standards of practice, right? Thinking about what does this practice of telehealth look like for our clients? We want to do some things that maybe get overlooked or not thought about in the same way, but we want to verify the client's identity, right? How are we doing this? Are we, how are we making sure we know who it is? Do we have good intake protocols, right? Are we getting all the information we need from them? If we're seeing them online, we're going to start to get to know who they are. If we're transferring them from in-person to telehealth, we've already built that identity thing in place, but just making sure we know who we're meeting with. And if it's a child, right, how are we verifying kind of who else is in their life and who else may come to a session or be on screen, who are the parents, who are the grandparents, who's a part of their life. Making sure they're consenting to online services, right? Talking about what this means and what this looks like, and making sure that they have a full understanding of what they're going to be starting. We talked a lot about confidentiality, right? And making sure that we're using software that's HIPAA compliant. Most major servers are at this point. Ensuring that both you and the client have a safe location, right? So we talked about not driving. We talked about limiting background noise as much as possible, making sure you're not going to be interrupted. Safety protocols, right? So what are you going to do if someone isn't safe? Do you have an emergency contact phone number for someone? Do you have a way to get a hold of parents if it's a minor? Do you have their local emergency line? If they're not local to you, right, and you call 911, you're going to be routed to the 911 closest to you and not to them. So making sure you have information about their emergency lines, making sure you know their address, or if they're meeting you at an alternative location, where are you, right? Like, let me know where you're at today. And then that alternative contact that we talked about earlier, right? What if technology fails? Who's going to call who? How long should we wait? What is the best number to call? If there isn't a number to call, do you want me to email? Do we want to use the chat box if it starts buffering? Do we want, what does all of that look like? And all of that can be set up at the first session and then checked in on every session. Hey, like, I know you normally, you meet with me at home. Are you in a different room today, right? Or are you somewhere else completely? Oh, you're over at your cousin's house today. Okay, like where do they live, right? Like, let me know where you're at so that if the worst thing happens, I know how to get services to you. So some additional standards of care, a lot of these we talked about, right? But the setting, making sure they're in a setting we don't really have control over their setting, right? The most I can usually hope for is that it's somewhere where we don't have 100 people barging in during their session. But you have a lot of control over your setting, right? And making sure that you are showing up and presenting yourself professionally, right? So if I show up and my background is full of stuff, right, it just sort of sets that scene for chaos. And it doesn't have to be anything elaborate, right? But a plain wall, or a wall that looks like what you want to show them, or making sure we don't have stuff all over the floor. The same, you wouldn't have your in-person office, right, be in complete disarray. So we want to give the same respect and the same attention to our online setting for those clients, and really set the tone of, I'm here to work with you in a professional setting. Making sure that our documentation is on par, right, and is the same as it would be in documenting, that it was a telehealth session, but giving the same respect to documentation that we do with all of our other sessions. Again, ensuring that confidentiality, both technologically, right, and making sure we're keeping track of how we're ensuring confidentiality online, but again, also making sure we're in a space that is private. If we need to do things like put headphones in, if there's any worry that somebody could overhear our sessions or things like that, doing the most that we can to protect that for them. We talked about, private location. So in addition to having a nice setting, right, I may have a beautiful setting on a beach somewhere. It may look very nice and calming to the client, but it's not private, right? So we want to make sure we've got both of those pieces in place. And again, professionalism, right? Like, there's been a lot of talk over the last 4 years, right? Of, I used to show up for Zoom meetings like completely dressed and ready to go. And then kind of the memes or videos, right, of like that, like, this is how I show up. We still are a professional. We still want to show up professionally for our clients. And so making sure that while we're comfortable and wearing things in a space that we can work in, that we don't let that slide down that scale of professionalism to a point that it no longer feels that way. And avoiding dual relationships, right? This one is kind of twofold, especially with things like telehealth. We obviously want to make sure that we're avoiding typical dual relationships, right? We don't want to be providing services for people that we know in any capacity, right? Or people who are related to us or friends of us or things like that. Telehealth sometimes just as a nature of the difference in professionalism, right? Or this really came from kind of the peak of COVID as well. But when we have those shared lived experiences, right? Avoiding dual relationships in the form of increased self-disclosure as well, right? Remembering we are the professional here. We are providing this service for our clients, and really, again, maintaining that professionalism with those clients, and not just becoming conversational with them, and avoiding that style of dual relationship as well. Our ethical obligations are across the board, right? We don't lose our ethical obligations. If anything, right, those are maintained across telehealth. So our duty to clients, right, making sure that we are acting ethically, making sure that we're showing up for them, making sure that we are engaging in behavior that's appropriate for those clients. Our competence, right? With telehealth, we want to make sure we're not only competent in the clinical information that we're sharing, the clinical practice that we're doing, but in our technology as well. So if somebody's just making the move to telehealth, I want them to spend time learning about their computer, learning what buttons to click, learning where these links go, learning what that is. We want that competence in our service delivery as well. And we ethically owe that to our clients. We don't have to necessarily be, the most technologically proficient human on earth, but we do need to be competent in what we're doing. And that goes a long way, right, to ensuring that we are doing things like sending video links to the right place, right, or in the right format, and protecting their confidentiality, which is our other ethical obligation. So how do we take all of these pieces, right, and implement them? So we've learned, okay, this is what I need to do. Legally, these are my obligations to my clients. Ethically, these are my obligations to my clients. But how do I take all of that and do telehealth? And to really think about that and to measure effectiveness of telehealth, we have to consider multiple perspectives, right? So we need to look at the perspective of the client, of the provider, of the programs, of the communities at large, right? Of is this effective? Just because research says that it is, or because one client likes it, or one of our providers is like, no, I don't ever want to go back to in-office stuff, is the way that we're doing it as effective as it could be. And so making sure that we are paying attention to all of those pieces. So what does research tell us? There's lots of research out there. Research has been expanding tenfold, especially since 2020. But research is really what's telling us from the educational perspective, right? Is telehealth effective? And there's some great research that came out of an outpatient clinic in Denver, Colorado. And they took information 12 months after they moved their clients to telehealth. So they moved their clients to telehealth due to COVID. And then 12 months after that, they took 2 months worth of client data or information. So they said, hey, in January and February of 2021, we saw 596 people, and we're going to send them a survey. And what they found is that clients were satisfied or very satisfied with their online mental health care. There were no negatives reported about telehealth, which is kind of crazy, right? I imagine that like the further out we go, people probably now have a few negatives, right, or things that they would change. But at this time, out of their 596 people, they were like, no, we're good. The only exception to that is that clients that were aged 70 or older reported they didn't find it as effective as in-person services. And again, that could be for lots of reasons, right? Their access, their comfortability, their competence, whatever those may be. But what this really kind of helps with, right, is establishing that proof, if you will, that telehealth is effective. And in this case, these clients, some of them had been seen in office prior to switching to telehealth. Some of them had not, and there wasn't any statistically relevant information, right, that effectiveness was impacted by their previous their on-site session. So whether they had been seen on-site before or not, effectiveness wasn't impacted. They all still said, yep, like that's great, love it. And again, there's hundreds of thousands, not hundreds of thousands, but lots of research coming out that you can really deep dive into about the effectiveness of telehealth, limitations of telehealth, all of that. So how do you select your technology, right? So how do you decide what you're going to use, what you need, right? How's all that come together? So thinking about all of the technology that you currently use at work, right? A lot of us are going to have an electronic health records system, right? An EHR. A lot of us are texting, right? Whether that's to coworkers or clients at times. Email. How are we storing documents? How is your agency accepting payments? What are you using for video conferencing? What phone carrier are you using, right? Do you have an electronic fax set up, right? So thinking about, okay, what are we currently using? What do we have? What do we need? So what are my goals? What do clients prefer? I was listening to a training the other day that took me back a ways, and it was from early 2020, and one of the providers was using like WhatsApp, and I was like, I can't imagine doing therapy on WhatsApp, right? But at the time, like that was what they had, and so figuring out, is that what clients prefer? Is that what you as the provider prefer? What makes the most sense? We personally, at our agency, we've switched over the years. We started with what felt like the right fit in the height of emergency, right? And what was HIPAA compliant. And then we learned that we could switch to platforms that made it easier for us and for clients. And so being able to make those adjustments and kind of continuously assessing, does it work well with your current technology? Does it work well for clients? Is it a server that is easy for them to access, or is it something that there's a lot of hoops to jump through? Just really making sure that you're assessing all of those kind of fit pieces as far as technology is concerned. So again, just kind of a nice graphic, right? When we think about telehealth, right? And when we're thinking about what devices to use or what platforms to use, I think that this just does a really good job, right? Of thinking about, okay, it's connecting you to clients in multiple locations, right? So how do you make yourself present for clients in various spots? Are you somebody who's office based but has some telehealth clients, right? Are you seeing them from your agency or clinic in their home? Are you providing a service that is a really specialized service where clients may be at another agency or inpatient somewhere, right? Or somewhere else in a clinic setting, but need your specialization. So you're actually meeting with them from your clinic to theirs. Are you both at home, right? Or are you providing potentially community services? We have a provider who does some community groups, but would have the ability to do that group via telehealth if needed. And so just kind of thinking about, okay, what's my intention? What platforms do I need as I think about where my clients are at and what they have access to? So thinking about, what do you do in person, right? If you're meeting with a client in the office and you're having a session, how do you translate that online, right? That's what we're doing with telehealth, is we're taking our skills as a provider and moving them to a screen and doing our very best to connect with those clients and transmit those skills via technology. So setting up telehealth, right? Thinking about that, setting up your session. We talked about this a little bit earlier, but that's what's going to communicate your intentions for the session, as well as your expectations for the client. So I want to set up somewhere where I have good lighting. And I say this a little tongue in cheek today because my ring light ironically went out just the other day and I haven't replaced it yet, right? And so, but we want good lighting. We want lighting in front of our faces. So whether that's a window that we can set up under or some sort of light, clients want to see you. And the more that they can see you, the more they can see your facial expressions, the more they can engage with you and feel present. So we don't want to be too far removed. We don't want to be hidden from them. We don't want to be in the dark. What's your video quality like, right? We don't have all of the control over this, but we definitely want to make sure that we're set up somewhere that we're, especially if we're fully telehealth, we want good bandwidth, right? We want to make sure that we're in a situation where outside of the occasional technology glitch, right, that clients aren't distracted by a constant drag or hiccup or just poor quality. Same with audio, right? Making sure they can hear us, checking that at the start of each session, right? Can you hear me okay? Like, do I need more or less? Making sure your background is something that's suitable for clients, right? It may be your favorite picture ever, but if it's something that maybe isn't going to resonate with the clients that you serve, if it's something that could potentially be triggering for one of them or distracting for one of them, right? Making sure that they feel safe in your space the same way we would make sure they would feel safe in our office space. And so kind of thinking about making sure that is set up the same. Where are your eyes looking on the screen, right? And I think that this one's really important because it's not one we think about all the time. Like even today as I'm talking to you, right? If I have my slides in front of me so that I know what I'm talking to you about, but I move over here, right? Now I'm looking at you on my screen, but it doesn't look that way, right? To you, it looks like I'm looking somewhere else. And we've had some clients comment to telehealth providers about this, like, hey, it didn't feel like you were connected to me. And it was a situation where that provider had dual monitors and was doing like some psycho ed and some things. And so looking at resources for them, but it didn't look like they were connected with them. And so those are things that clients pick up on, right? Again, if I'm in office and I'm staring out the window, right, you're gonna be like, hey, like I'm here. And so we know that people get tired of looking at themselves. There's research that tells us a lot of people like to minimize their own view on Zoom and things like that because they don't want to see themselves. But it's really important to make sure that we're connecting with those clients on screen. Along those lines, right, making sure we're not too close or too far away from the camera. And again, backup plan, backup plan, backup plan. You'll hear me say it 1,000 times. So what happens when your camera doesn't turn on or it goes out or things happen? With children in particular, right, there's some additional setup things we want to be mindful of. So what supplies do they have? What do they need? Are they kids who have access at home to pens, paper, crayons, things like that? This isn't a play therapy telehealth specific training, so I won't spend a ton of time on it. But for kids, it can be really nice to have a basket that's like their telehealth basket. And so they're not utilizing those tools every day. So similar to when they come into their office, they get to use your office things. This could be a basket that their adults put together that they get to get out when it's their time to meet with you, so that you know, hey, if we're going to do an art activity, they've got crayons in there or markers or whatever it may be. What's their lighting and background look like, right? Again, like talking to kids, I have kids who like to turn off the lights or climb under their blankets and make a fort, right? And so just being mindful of how am I going to engage them, right? Oh, I can't see you, right? Like, oh, let's see if I can see you if you turn your light on, and trying to get them somewhere. It may not be ideal, but I'd like to be able to see them and their facial expressions. knowing who's going to be present. Is this a kid only session? Is this a session that an adult's going to join them with? Is there anything before you get started that the parents need to help get? And what technology are they capable of absorbing and sharing? Are you able to screen share with them, or not, right? And that's going to depend on the kid and their comfortability and access. And is movement an option, right? So being mindful again of what's your space look like, what's their space look like. Can we take a movement break? Can we stand up? Can we do some stuff to kind of keep them engaged? And making sure that you have your things as well, right? So making sure they have their basket. But I always tell providers too, like, you don't want to be like, hey, this kid's really engaged. I don't have what I need, so I'm going to go off camera to rummage around and find it. Like, nope, like, you want your telehealth basket with you as well, and making sure you've got easy access to whatever supplies you need for that session. With teens, right, same thing, just some special considerations. Do you need a check-in with parents that day or not? Or are we good to just kind of rock and roll from the start? Do they need any supplies? I like to know what they're on, right? Are they on a phone, a tablet, a desktop? It's easier for them to be distracted on a laptop, a desktop, a tablet, because they're going to split screen you and they're going to do what they want. They're going to be scrolling whatever they're scrolling while they're doing that. A phone is a little bit harder for them because it often will like shut you down if they go scroll other things. But also, like, what websites do you access most often? Are you screen sharing with them? Do you have those easily accessible? Do you know, what's your plan for today with teens? Be present, right? Just as you would in session, but you really want to strengthen your rapport with that client so you can better understand their perspective during the session. So just as you would during an in-person session, you want to limit distractions. So you want to close your other browsers. You want to put your phone away. You want to turn off your notifications. It's really tempting for us to check an email or Google something, or check a text or whatever it may be. This is your time with the client, and you would not be doing those things in person. So making sure that we're not engaging in those behaviors online with them either. They're going to notice. They may not say anything, but they're going to notice. And enhancing your communication through intentionality, right? So leaning forward, utilizing facial expressions, making sure you're aware of your voice tone, right? And with kids in particular, just changing that voice tone can kind of draw them back in and enhance their engagement. Being mindful of your posture, right? This is very different than this. And not to say that one is necessarily right or wrong, like, your client and where your client's at and what they need, but being mindful of that and being mindful of your body movements. I always laugh when I do these trainings because I talk with my hands a lot, but you guys don't see that, right? Because I don't talk with my hands up here so much as down here. So my clients aren't going to see things either. So some things that I may mime or mimic, right? They're not going to see. So being aware of that, and communicating with them as to, like, hey, this is what I'm doing, right? Or if my eyes aren't on you, it's because I'm looking at this note because I want to make sure I get it right? Or I'm accessing this resource. And so, like, if we were in session, right, you'd see me holding it. I'm not holding it today because it's on my screen, but if it looks like I'm not looking at you for a second, right, it's because I want to read this to you effectively, or, as it's written, and just communicating that with them because they can't see what you're doing on screen or outside of the window that they get. Ensuring their safety, right? So we talked about this at the start of today. It really is a gift to be able to meet with the client in their space, right? So they're choosing what you get to see as well. And for some, that may be, it may be like up their nose, right? And little kids, and like for some, it may just be their face. And for some, they may want to show you their space, right? And I don't ever want somebody to take for granted, like when a person, right, gives you a tour of their room or a tour, like, they're showing you stuff that is sacred to them. So we don't want to ever force or urge a client to show their space until they're ready, if they ever are. But when they do, really kind of understanding what they're giving us in that room tour. It's not just their pink walls, right, or their Spider-Man toys. Like it's a look into their safe space. We want to be flexible and transparent, right? So for some people, starting or moving to telehealth could be good, it could be bad, or it could just be unknown, right? It could just be new. And so making sure that we're checking in with them. Am I too close? Am I too far away? Does this all feel okay? Like I'm going to make adjustments, and I'm going to constantly make adjustments if needed, and we're going to figure this out. People that work with me know my office has undergone a lot of adjustments in the last several years, but this year in particular. And my background has changed, and my view has changed. You know, I've moved my desk around and changed my wall. Again, if I was in office with clients, they're going to notice, and I'm going to let them know, hey, I'm going to paint over this weekend, or I'm going to move offices, right? Or I'm going to do this. I want to be mindful with them that it's still different when they log in to see me. It's going to look different. And with kids and adolescents, a lot of times too, they've got to kind of test you out again, right? Like, are you who you are? Are you where you're supposed to be? So checking in with them about that, and not ignoring interruptions or weird things that happen, right? I think sometimes there's a tendency to be like, I'm just gonna pretend that noise didn't just happen, right? Or like if my bookshelf falls down, right? And I look up, my client's gonna not see that, but they're gonna be like, what just happened? Like, it's okay to be like, hey, bookshelf just fell, right? Like, I don't want to ignore those things. If I shut my door to my office, if somebody starts to open that, right? And I can acknowledge, like, hey, like I needed to make sure people didn't enter our space. It's safe now. And for some clients, I may need to show them a better view of my space, right? To then ensure nobody's in here. So not ignoring those interruptions or things that may happen, but being transparent about them. Engaging in some personal and professional reflection, right? So cultural considerations can transcend virtual spaces. We're not immune to that because we're online. And so continuing to reflect on things like power imbalances, continuing to create that safe space. So exploring with clients what their expectations are, how they're feeling about us being in their home. Maybe it wasn't their choice to do telehealth. Maybe they don't have any other options. Maybe medically they needed to be home. Similar to clients who are in like court ordered therapy, right? Like it's not their choice, but they're here. How are we feeling about that? Are they able to access a space that's private enough to open up in therapy? I think back to a supervisee, who was working with a young parent who was doing telehealth, but had children home with them all of the time. And the child was young enough that it was like, well, I can talk about things because this child won't understand what I'm saying. But they physically weren't able to create a space that allowed them to stop being parents and allowed them to just be clients. And so there was a lot of barriers of, yes, because of telehealth, you can get to services, but those services look and feel a lot different because you're not alone in that session. And so just being aware of things that can impact those relationships. But your general therapy skills go a long way, right? Continuing to be curious, engaging in reflective listening, being compassionate, and being transparent. Being direct, right? I was gonna say I'm not direct. I probably am, but I'm not as direct as some. But online, we can't feel the energy that's in the room, right? Sometimes we can see a shift in body posture or in facial expressions, but it really does become important that clients verbalize more of what they're feeling, especially if we're doing phone sessions, right? Because again, like your client won't feel the shifts the same way in the room either. And so it may be important for us to share more than we might in an in-person session, right? Of, oh, what you just said, right, has me feeling worried, right? Like I'm wondering if you're feeling worried about that, right? All right, like, and really being able to be direct with them, ask more reflective feeling questions, so that we can strengthen that therapeutic relationship and learn to kind of feel that person over the internet. So some special considerations. So we've got some time today, and I think that, again, trying to stay current with trends, with things that that are relevant. There are some special considerations that aren't necessarily related to telehealth delivery, right? But the ethics of social media and what that's doing. If we're meeting with clients online, we can probably safely guess they're engaging in other online behaviors as well. And I think as online providers, it's really important that we know what's happening kind of in the online world around us. And so taking a short look at social media ethics and things like TikTok advice and self-diagnosis, and what that can mean for clients that are either currently working with you or starting their journey with you. So this is an Instagram post. There's a couple of them here. And I will say this is not necessarily to pick on this one provider, but I want to kind of share this with you. So this Instagram post has 3,156 likes as of 2018. So I can only imagine how many more at this point. But what it says is you cannot heal trauma by talking about trauma. And essentially the long post associated with it goes on to talk about how worthless traditional therapy is, and how that talking about trauma only just solidifies trauma pathways in the brain and makes it worse. The second post by this person talks about how that there's no reason to engage in diagnosis, and that nobody should have a mental health diagnosis, because in order to heal, you need to just think about how much better you want to be. So in addition to those posts, things on that Instagram account have said things like, we all have the privilege of choosing our mindset. My deepest belief is that we are 100% responsible for our thoughts, feelings, and reactions. And this is empowerment regardless of where you came from. So you can fix yourself, right? Is the tone of this Instagram account. You may be sitting there thinking like, who cares? No big deal, right? People say things online all the time that aren't true, aren't relevant. Who cares? The issue with this is that all of those posts and hundreds more were shared online by a woman named Nicole LaPera. She's better known online as the holistic psychologist. She's a psychologist. She has a PhD. She has an online therapy business. She has 2.6 million Instagram followers. She's a professional, right? And so she's posting and promoting this ideal of total personal responsibility, including things like healing from trauma and mental illness, and really encouraging her followers to just disregard the mental health community as a whole, and engage in what she promotes as self-healing. And so one of her famous quotes is that the thoughts you have around diagnosis are the most powerful deciders between sickness and wellness, right? So I'm just going to decide that I'm okay. And again, this isn't necessarily just to pick on Nicole. There are research articles that do that on their own. If you're interested, they're linked in the references. But this really goes to show that there's some dangerous stuff online. And here's this doctor, right? Here is this PhD. Here's this psychologist who's now telling us that mental health care is bogus. And this has been shared and posted by Hollywood celebrities. And there's been some comments by Hollywood celebrities of like, you're the best thing I've ever found. I wish I would have found you 20 years ago instead of wasting my time in therapy. And they're all entitled to their own thoughts, right? But what happens if a client or a potential client sees this and then isn't seeking mental health care, right? Because they're getting the message that they shouldn't or they can't. And so just, I think it's always really important to kind of be aware of what's being posted online, and talking about, the ethics of we as healthcare professionals, what should we be posting or not posting? What are the messages that we are putting out into the universe? Because those could be, easily seen and picked up by other people. One of kind of the biggest voices against the holistic psychologist and other platforms kind of promoting that is a woman named Root Chwala. I'm going to mispronounce that, and I apologize. But what she states is, as helping professionals, we have an ethical duty to consider the most vulnerable populations when speaking publicly and healing mental health. And I think that that's really important to consider, because again, while other people may see post and go, oh yeah, like I've tried therapy that didn't work for me, but I've really done some self-healing, or I've really found this alternative to be beneficial, or like I was, I chose not to take meds, but I did this. That's fine. And people absolutely have autonomy to make health decisions for themselves. But what we need to be mindful of, like she talks about here, is the most vulnerable populations. So those individuals who don't have the capacity or the ability or the experience to do that level of self-reflection and simply see the face value of therapy is bad, or a mental health diagnosis is bad, or I shouldn't do this, and really making sure that we are mindful of our ethical duty to protect those populations and what we're posting and sharing and stating to the world. TikTok has become huge, and so my slide is missing, but that's okay. So TikTok has over 755 million users. So many of our clients are on this platform. During the pandemic, the number of social media posts that mentioned mental health grew by 80.53%. So mental health is tagged over 53.9 billion times on TikTok. And I've got a couple minutes, so I'm hoping this will work to show you guys a couple of these. I didn't search for these, right? I didn't go like seeking certain things to prove a point. I literally just typed in the hashtag mental health, and these were some of the first ones that came up because that's what our clients are doing. So hopefully this will work for us. Okay, I don't know why it won't let me, and that's frustrating. But what he talks about is 4 signs that you didn't know you had high functioning anxiety. And while what he says, like maybe, right, doesn't necessarily mean somebody has high functioning anxiety. It can mean a plethora of things. And the biggest frustration for me with that one is that that creator has a little blue check mark by their name, right? Which means that they're legit. However, they're not a legit mental health professional, right? They are legit in that they have over X number of followers. And he's promoting, things like BetterHelp and things like that, but he's not a mental health professional. And so we have these people clicking on that going, oh, I have high functioning anxiety. And the rest of these are similar in nature, right? Of things like you have ADHD if, you have this if, and the other slides will elaborate on this. But yeah, if you have TikTok, or, somebody in your life has TikTok, search mental health. And it astounds me, like what comes up. And again, that's what our clients are doing. And so being aware of what they're getting access to, and just knowing kind of, I don't want to say what we're up against, but what we're up against as mental health professionals. And kind of in that vein, right, there was a study that looked at 500 videos searching mental health advice and mental health tips on TikTok. And they transcribed each video. They used some medical professionals to assess the accuracy of the advice given in the videos. And then they went further to kind of label the videos as misleading. And so they considered a video misleading if the advice was inaccurate or potentially damaging, if the host was unqualified and didn't give a disclaimer, similar to the last video we watched, or if they encourage a client to engage in self-diagnosis, right? So they were like, hey, if it does any of this, this information is misleading. And what they found is, it shouldn't be shocking, but it's shocking. to me. What they found is that 83.7% of mental health advice on TikTok is misleading. 14% of those videos could include content that could be potentially damaging. Of those 500 videos, 100% of the content for ADHD had misleading information. Things like bipolar disorder and depression were above 90% misleading as well. 54% of the advice contained accurate information, but 31% of the videos contain inaccurate information. So it was like, okay, there's some information here that's accurate, but it's misleading, right? Which is similar to the first video on that list of like, sure, like some of this information is accurate. You could have high functioning anxiety but it's misleading in the sense that one, you're not a qualified professional to be talking about it, and two, it doesn't necessarily mean that somebody, who has that symptom or that behavior does. Only 9% of TikTok creators advertising on the platform had any sort of relevant qualification. So that left 91% of them who just were saying things, without any sort of qualification. So the misleading videos, right? We talked about that. ADHD, lots of misleading information, and then misleading information about bipolar disorder, depression, anxiety, general mental health concerns, and trauma. This just kind of talks about, again, how accurate is the advice on TikTok. So the blue is accurate, pink is inaccurate, purple is potentially damaging. So looking at just kind of the numbers there. So it's like, yeah, we've got a little bit of like, sure, that's accurate. But a lot of it is not accurate, and at worst, right, it's potentially damaging. So the biggest thing, the reason they kind of noticed that trauma is so inaccurate, as we all know, right, is because people's experiences with trauma are so vastly different. And so it's really hard to give any sort of accurate information about other people's trauma when you haven't met them and you don't know them. Self-diagnosis on social media, right? We'll kind of go real quick here. But social media allows us to share our experiences. It's great. It's wonderful, right? We want to be able to share experiences and things like that. We do know that 1 in 7 adolescents, so ages 10 through 19, will experience or are experiencing a mental health disorder. But the issue with self-diagnosis and social media, right, is that we can often engage in confirmation bias, right? So we can gravitate towards information that we agree with, rather than information that's true. So again, those videos, there's so many right now on TikTok and other platforms of like adult ADHD. I can watch all those videos and see myself in any of them at any time. I don't have ADHD, right? I haven't been diagnosed. I self-diagnosed, right? But we can kind of engage in that confirmation bias of like, oh yeah, like I must, because this video says that I do, even though it's not true to me. Some of the other dangers with self-diagnosis online are that we can become reliant on social media instead of getting the professional help we need, right? Like, oh, I found this content creator. They specialize in tips for anxiety management. Cool, I'm just going to watch their videos, right? And do what they say and not seek any professional help, or delaying seeking help from a professional, right? Like, okay, I'm good. And kind of putting that off. It also can result in wasting valuable time reading or watching content with inaccurate information, right? We just saw all of the slides, and while that was a fairly small study, right, 500 videos isn't anything crazy. I can only guess it would get worse if we added more videos. And so we're watching or reading information that just isn't accurate, right? And then kind of bringing it to the table, thinking that we know what's happening or what we're experiencing. And it can also result in spending money on products that are being promoted by influencers that just don't work, right? Or that have little validity, because they're really good at what they do, right? That's literally their job, is to get you to buy things, and they're really good at it. And so our clients can end up kind of finding these miracle cures or things that will fix everything, and not. So how do we kind of mitigate these risks of social media, or how do we help our clients rather kind of do that because we're not going to stop them, right? Like, yes, they're going to be on social media. Their friends are going to be on social media. Their kids are going to be on social media, whatever it may be. But we can help them kind of recognize that they should be checking for credentials, right? Who is this person? Like, what gives them life experience or education to be sharing this information? Knowing that, hey, like, sure, go get some education, but we're not doing therapy on TikTok, right? So go learn some things, bring them back to the table. We can discuss them. We can talk through them. Grab some education. I'm all for it. But you're not doing therapy with that content creator. No one should be diagnosing you without meeting you, right? So if I watch a 30-second video that's, convinces me at the end that I have some diagnosis, even if all of those symptoms are true, right? Ethically, no one should be convincing anyone or telling anyone they have a diagnosis when they have not worked directly with them. It's also important to note that information online is going to be simplified. They have a very limited amount of time to get information in, right? They're not sitting down doing a 2-hour CE training via a social media app. They're doing a 30-second, maybe a 3-minute video. Also, trending doesn't necessarily equal current or accurate, right? So there can be things that take off that are really old, right? But all of a sudden they've resurfaced, and it's trending. And so I'm gonna hashtag it or do this, but it doesn't necessarily mean it's the most current or accurate information. Again, warning our clients, like, just be cautious of people that are selling things. And are people talking about their own lived experience, or are they sharing evidence of something and differentiating between a shared experience, a lived experience, and scientific research-based evidence of something that they're presenting. So as you continue your telehealth services, right, just some tips, as you're sitting down with your clients, make sure you're in a safe space. If you need to put a sign up on your door so that others know you're in session. And that's something that's great to do if you're at home, right? Like, hey, nope, busy, I'm at home. Or if you're in an office, right? If you're seeing clients in 2 different settings, sometimes somebody in the office may be like, oh, I know that so-and-so doesn't have anybody in here because the parking lot's empty, right? So I'm going to go say hi to that. Like, nope, I'm still in session, right? I'm doing a telehealth session. Make sure you have everything you need, right? Refill that coffee, make sure you've got water, have your basket of whatever you need. Use the mute button if you need to, right? We're intimately close to people when we're on the screen, right? And so if you need to cough or sneeze and you have time, hit that mute button, right? So that it's not directly in their face. Take advantage of that. Have good lighting, and then use headphones for extra confidentiality if needed or wanted. But thank you all very much for joining us. If you have any questions, you can email me, you can contact us. If you love this training so much and you want to do a training on any topic you want, Heart and Solutions does have a whole training wing, right, called You Need a Training. And we invite guest trainers from all over the country that they can come and do a CE approved training for us as well. So if you or anyone you know want to do that, we will gladly take you. Resources are all listed, so if you need anything. But any questions or thoughts before we wrap up today? Perfect. Make sure that you guys open those links. If you have any issues with your evals or getting your certificate, let me know. Those should all be automated, but I appreciate everyone being here. Go stay safe and warm, and thank you all very much.
Thank you for joining in on today's training. We look forward to having you join us again. Heart and Solutions is proud to provide CE eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below.